So okay guys, once see here a case. Okay, so a 60-year-old retired banker and right-handed man is brought with complaints of speech difficulties. He speaks fluently and with a normal grammar. He appears to understand both verbal and written commands. Okay, whenever he asked to repeat the phrases, he is not do so that one. He is unable to repeat the phrases, meaning he is the 25 he is the 60-year-old bank retired. He can speak well, he can understand well. Okay, but when the doctor told to repeat the phrases, he is unable to do that one. So where is the problem? Okay, to know this answer guys, let's have a brief discussion. Okay, a let's go to the discussion. You will sure know that one. Okay. Okay, done. So here is the answer for that one guys. Okay, see here we are having the broadman areas. I think everyone knows this one guys. So we are having the frontal and this is the temporal and the temporal lobes here. So in frontal we are having the divided into three gyrus. This is the superior frontal gyrus, middle frontal gyrus, and this is a inferior frontal gyrus. Okay, come to the temporal here. This is what am I here, superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus here. Got it? So can you tell me what is the broadman area for the Brocas area, for the Brocas speech area? Tell me. It's a 44 and a 45. It's a 44 and a 45. Okay na? How to remember this one guys? Let's take a simple example. See, Brocas means it's a bath, means a bath karna, meaning there is a speech area. So speaking is what? Motor. It's a motor area. See, there is one word lies like before talking. You have to be clear about your word. Before talking, see before 4. See before talking, see before 4, so 44 45. That's it. This is Broca's speech area. Okay. Next one, coming to this one. When you have to speak, okay, then you have to understand also. Whenever you are going to understand the others words, then only you will speak na, isn't it? So you must have two areas, one for talking, one for understanding. If you don't have one, then what happens? There is a problem. That's why we have in the two areas, one for talking, one for understanding. Okay. Next one guys, there is a wernickes speech area, which is a sensory. Okay na, it's for comprehension, for understanding. Okay, this is where it is located at the superior temporal gyrus. Okay, where superior temporal gyrus. Okay, what is the number? 22 40 39. 22 39 40. 22 39 40. You have to remember that one. Okay na? This is the wernickes speech area. Got it? So can you tell me the location of the Brocas area? Tell me. It's located at the Watama inferior frontal gyrus. What is the broadman areas? 44 45. Tell me the wernickes area. Tell me wernickes area. Where it located? At the superior temporal gyrus. What number? 22, 40 and 39 area. Okay, got it? Yet clear? Got it? Okay then. Remember here one thing, Ra. Okay. This Broca speech area and wernickes speech area, they are both connected by fiber called as arcuate fibers. What is this, Amma? Arcuate fibers. Okay, arcuate fibers. Got it? So, okay now. So, tell me one thing, tell me one thing. If there is a, if there is a, if there is a lesion on the Brocas speech area, then what happened? Meaning, if there is lesion in the Brocas speech area, the patient can't able to talk. Okay, na? He is unable to talk, but he can understood, isn't it? Brocas बात करना. So, if there is any lesion to the Brocas speech area, then this patient cannot talk, but he can understood. Okay. Next, if there is any lesion to the wernickes speech area, 22, 30, or 22, 39, 40, there is any lesion to the wernickes speech area, lesion to wernickes speech area, meaning he can speak, because why? Wernickes for understanding. Okay, wernickes he can speak, but he cannot understood. He cannot understood. Okay, see, Brocas he can speak. He can speak. He can speak fluently, isn't it? He can speak fluently, but can't understood. But he can. Sorry. Actually, okay. He can speak fluently when there is no lesion. Okay, now when there is no lesion, but when there is a lesion, he is unable to speak, but he can understood. Here what happened here? Here he can speak fluently. He can speak fluently, but he is unable to understood. He is unable to understood. Okay, now remember here. What if there is a lesion to arcuate fibers? When there will be connection, when there is connection lost between the Brocas and the wernickes speech area, then what happens? This is called as your conduction aphasia. Your conduction aphasia. What is called as one? Conduction area aphasia. Okay, conduction aphasia when there is a lesion to arcuate fibers. So there is a no. Okay na. So there is a repetition problem here. What if there is a lesion to everywhere, Brocas, arcuate and wernickes? It leads to global aphasia. Okay, done. Okay, let's see this one. Okay, let's see this one. We can apply here everything. Yeah. Okay, here aphasia. Done. Okay, aphasia. We are having the aphasia. We are having Fatima. So this is your 44, 45 area number for the Brocas speech area, 22, 39, 49 for the wernickes speech area. So I told that Brocas for the what? For what? Your speech. Okay, and this is for understanding, comprehension. This is motor. This is sensory. Okay, so tell me if there is a listen to what Brocas area, listen to Brocas area, then what happen? Does he speak fluently? The patient can speak fluently? No, there is a non-fluent aphasia. Okay, na? And also, thus he can use a good grammar? No, agrammatic aphasia. Okay, na? It's also called expressive aphasia and Brocas aphasia. Okay, na? These are the same. See what happened? Brocas motor speech area 44-45 is present on where? Inferior frontal gyrus. As I already told you, inferior frontal gyrus. Here see, wernickes aphasia or receptive aphasia or fluent aphasia, meaning he can't understand anything, but he can speak fluently. So as I told that speech wernickes sensory area, speech area, it is sensory at 22, 39, 40. Present on posteriorly, which is posteriorly to the word where amma superior temporal gyrus. Got it? Yes. Tell me here. Speech. Okay now. Does see here speech becomes difficult? Yeah, difficult. But the patient understands spoke language. Okay. Here what happened? Unable to understand, but unable to not able to understand the spoken, but he can understand the language. Okay, but he can speak here. Okay, na? He can speak fluently, but he is unable to understand. Okay. Next, tell me here what is conduction aphasia. As I told you that what is the connection between these two guys fibers? There is a what? This is the your arcuate fibers. When there is a lesion to arcuate fibers, what happens? Might is lead to conduction aphasia, so that the patient will have the repetition problem. What if there is a lesion to everywhere? It is called a global aphasia. Okay, done. So let's solve the question here. Yeah, tell me here. Tell me here. So in this, what happened here? Speech good, understanding good. He lost the repetition. Then it will what happens? They listen to arcuate fasciculus. Got it? Brocas speak and normal is the here normal is speak fluently, but listen speech will be less. Understanding okay. Wernickes area normally what amma understanding okay. Okay. What happened here when the listen understanding will lost, speech is okay. Okay, got it? So guys, so this is very important guys, so you have to remember for your exam. Okay, thank you very much.